Hello, my name is Kremlin. In this section, you will be able to learn how to follow admission process in the acute rehab setting. The first thing that you want to do is make sure that if the patient is in the system, and by just going to the home, and the patient should be listed right here. So you select the patient, of course. Then, once the patient is in the system, you'll get your face sheet and an armband from the admitting department. You want to make sure that the face sheet has two doctors listed. One would be a rehab doctor and one is attending physician. The rehab doctor is usually selected by the attending physician. So make sure if the rehab doctor is not listed, you would want to call the attending physician and verify who's the rehab doctor on this patient. So once you've done that, you want to go to the order list. Let me select this patient, select one. So when you go home, once the patient is put in the system, the computer will generate several orders. These orders are to be acknowledged and signed off by the registered nurse. Once you do that, you just follow as you would do in every unit. You put in the vital signs, weight, and allergies so that you will be able to put in other orders. Now let's move on to the main topic, admission process. So, admission process is pretty much the same as you would do on any floor, but in acute rehab, there are different orders. The ordering process is quite different. I'll just start. So you select the doctor. Usually when you put rehab orders, you select the rehab doctor. But when you put in medications that have been ordered by the attending physician, of course you select the attending physician. For now, Dr. Jasper is the rehab physician because I am trying to put in rehab orders. So I'll click OK. Now, to place an order, after you get to this page, you go to rehab. Once you click rehab, you will be able to see rehab admission orders. And you click on rehab admission orders. So now, these top two orders are highly important that you remember to click. They should be clicked, selected at all times. And then you click that all applies. Of course, vital signs, diet, and if you notice, there is a weight-bearing status. Weight-bearing status is also highly important in acute rehab. So you'll be expected to know that the weight-bearing status of this patient and select it accordingly. Some doctors have their own routine orders, and you'll be notified in the floor, meaning like you will be oriented in the floor. Another important documentation would be the FIM. FIM stands for Functional Independent Measure. This documentation is done every shift. The nurse is required to have 4 hours of training before to start documenting FIMs. If you have not been trained, ask the charge nurse to document. Otherwise, after you select all the orders, of course, always remember to go order summary and review all your orders and accept them.
Hi, my name is May, and I'll be continuing the ARU training session. One of the admission documentations that we have in acute rehab is the team admission assessment. This will be automatically generated in our work list once the patient gets into our system. This documentation consists of 6 pages and it is being shared with the rest of acute rehab team such as PT, OT, ST, social worker, and nurses. Please don't get overwhelmed once you see the documentation because ARU nurses are only documenting on certain pages. First, click onto the Go To button on the right lower screen, and next you click on the next screen so that you'll be jumping onto different pages. The first documentation that we want for this documentation is on page 3, and you'll be able to see it over here. So we're on page 2, so you keep on clicking Go To or next screen. We are documenting on number 6, which is the bowel and bladder management. So once you're done documenting on that, you can go ahead, click next screen, Go To, and we're going to page 5, number 9, which is pain assessment. All of this are being documented based on your nursing admission assessment. After that, you go ahead and go to page 6, which is the RN clinical impression. On this area, you have to write a short narrative regarding the patient. You may write, or you might type, alert and oriented times 4, denies or complains of pain at certain site. Patient is continent both bowel and bladder. Once you're done documenting, please choose accept as partial so that other therapists will be able to document on this when they come and see the patient for the first time. So click accept as partial. And there you go. And our next topic is regarding discharge in ARU. Whether the patient is going home, going to a facility, different hospital, or even a change of condition, that needs to be transferred in different in-house units such as ICU, tele, or med-surg, we are treating all the situations as a regular discharge. However, the only difference is that you have to get an order from the doctor and enter it as a discharged patient from TCU ARU. Did I lose it? It's right here. Discharged patient from TCU ARU. So click that one. Okay. And then you choose accordingly. For example, we're discharging this patient to tele. I'll click discharge acute care within this hospital. And then over here for the option discharge, you choose this option if the patient is going home. And you choose transfer to another facility when the patient is going to ICU, tele, or med-surg, or if the patient is going to a different facility or different hospital, because this will generate the interfacility transfer documentation. So I click that one, and then you may go ahead, enter accordingly regarding the diet, if it's fluid restriction, and so on and so forth. Regarding this situation, this patient is going to tele because there's a change of condition. So any in-house transfer, admitting department would want you to put on number 10, discharge to wherever unit you want to transfer the patient. So we'll put to tele, including the diagnosis, so that in this way they can admit the patient on that unit. And then go ahead, you go read back, and then order summary, and then accept order. Hi, again, this time I will show you what Kremlin had mentioned earlier regarding FIM scoring documentation. You will only be documenting if you are trained or you've already attended the class. If not, then you may ask your charge nurse to do it for you. I just want to give you like an overview of how it looks like. So again, this is how it looks like, and you based your scoring on your assessment of the patient for the whole shift. Okay? That's how the FIM scoring. And when you discharge this patient, regardless of what time, you always have to have this FIM scoring record documented. Okay. To complete the discharge documentation when you had transferred the patient or discharged a patient, you go to the unscheduled documentation and you may scroll down all the way down to the ARU section. All of these from 83 to 88, these documentations are only meant for ARU. I had shown you earlier the FIM scoring. One more mandatory documentation for a discharged patient is the nursing team disease summary. So you go ahead. You won't actually see this on your work list, so you have to pull it from the unscheduled documentation. So it's right here. You'll document that one. And you go ahead, fill all this stuff, and you're done. This is the end of our training session, and congratulations for becoming an ARU member. We will see you soon.